my Hemi-Walker, and I'm sure some of you have never seen this, okay? A Hemi-Walker, H-E-M-I hyphen Walker, H-E-M-I, I'm sorry, not Y, H-E-M-I hyphen Walker, Hemi-Walker. Hemi meaning half. So it's like a what? It's like a half of a Walker, basically what it is, okay? But look at the structure of it. What's unique about it? It's kind of straight on this side, right? Flat on this side, it kind of curves out on this side, right? Straight on this side, curves out on this side. The type of patient who would use this, the Hemi-Walker, would be a patient who had a stroke. And one of the reasons why you probably haven't seen it, if you haven't seen a lot of stroke patients, you may have seen them use this one here. You probably have seen more of this with the quad cane. And that's because usually when a person has been recently diagnosed with a stroke and they're coming out of the hospital or they're still in rehab or something, they're using this, okay? So with the Hemi-Walker, make sure I show you everything, don't miss anything. You're putting all of your weight into this when you're leaning in. So if my left side is my affected side, I'm going to put all my weight into my right side. You also have an extra handle to help you get up. So I'm going to use this chair here to demonstrate, okay? And so this is one you probably will not dispense to a patient, because unless you're working in a rehab or physical therapy or in a hospital, you most likely will see a patient with this more than help them to be dispensed this, okay? But you can also advise them if they're not using it properly. So again, the first thing I need to do is what? Measure the handle. Not this handle, not the bottom one, the top handle, okay? So as you can see, I have 4 buttons again. So I'm gonna try to push this, probably need it all the way down, because yes, I am short. Let's see, I'm gonna put it all the way down. I just have a feeling I'm gonna need all of it. I'll be happy if I can raise it one. That'll bring me joy. Just push that in. Let's see what we have here. Oh yes, I get to raise it. I'm excited. Maybe one more. All right. That's about right. Okay. All right. So as you can see, it's right to my wrist. All right. Now, as I said, this is uniquely structured because it's for a person who's had a stroke. So I'm going to act like I've had a stroke on my left side. A lot of times you'll see what? A contracture of their arms and hands. My leg may even go in because it's contracted. My whole left side is going to be contracted. The flat side is what goes on my non-affected side. The flat side goes on my non-affected side, okay? Because if I had the curved side on my non-affected side, what would happen? I'd probably hit it, right? Because it's bent out. Or curved out, I should say, okay? Now, the other thing is I'm gonna sit, and as I said, I have the flat side here. So I'm gonna demonstrate as if I've had a stroke and I've recently been diagnosed, and now I'm trying to progress. I'm, moving on to getting out of the bed and now trying to ambulate. And this is one of the first things that they may try to give me to ambulate, okay? So what I'm gonna do is I'm gonna use the lower bar handle to get up, not the top one, okay? So you kind of place it here at an angle, and I'm gonna lean in because my right side is my strong side. So I'm gonna lean in and get up and then switch, okay? Now, because I am affected on the left side, it's not a 1-2-1-2, they go together. So my affected side and my cane go together because it's giving me the support that my left side can't, all right? And I'm leaning into this. So now I'm leaning because I don't have any weight. I can't put any weight on this side, right? Because I've had a stroke on the left side. So again, I'm putting my walker and my affected side together and leaning in, and this is what you would see, okay? All right, okay. So, again, you have the flat side on the non-affected side, curving out, okay? You're going to get up using the lower handle first, and then leaning in, switch to the top. You also have to make sure that you measure not to the bottom handle, but to the top handle where the wrist is, okay? So this is for someone who's recently been diagnosed with a stroke, okay?